Hello and welcome to today's episode of life-saving procedures that can be carried out anywhere to save the life of someone who is in an emergency situation. Today we'll be looking at choking in babies. Choking in babies within the age range of 1 to 12 months. We refer to them as infants. So we'll be looking at choking in infants. What's choking? Choking is a sudden obstruction of the flow of air, which carries oxygen into the body through the respiratory tract, starting from the nose. This sudden obstruction usually occurs as a result of an object blocking the airway, most times through the mouth or even through the nose itself. Choking can occur as a result of either food particle or a little bead or a coin have been inserted either through the nose or through the mouth and is obstructing the airway at the back of the tongue, the throat region. Caregiver or whoever it is that is within the primary vicinity where this child is choking, you have a responsibility to carry out certain life-saving procedures before proper help arrives or before you get to the hospital. You need to be able to recognize that this baby is choking, because the baby is not going to tell me, oh, hello, I'm choking. No. So if I am unable to identify the signs that is telling me that this baby is choking, this baby will deteriorate. Why is this important before we get to the procedure itself? It is not enough to know what to do. You should be able to identify when to do what you know how to do. Okay, so this is the reason why the signs of choking in infants are very important. Number one, there's abnormal cry. Abnormal cry. The cry can be weak. Okay, there might be no cry in extreme cases of choking. Okay, so you look at the baby is not crying properly. Number two, you look at the breathing pattern is abnormal. You look at the chest wall, there is inward drawing of the chest. Okay. Number three, when the child is breathing in, you are hearing abnormal sound. You know this is not normal. Okay, the child can be choking at that situation. Of course, choking is not the only cause of such abnormal sound, but first things first. So you look out for choking in this child. You see bluish discoloration of the lips, around the mouth, and then the extremities, the hands, the feet of the baby. These are signs of choking in a baby. So what do? Number one, call for help. Call for help. So it's either you call an ambulance or you call someone who could take you to the hospital. Call for help. One of the challenges with carrying out this procedure is anxiety. When you are anxious, afraid, and scared, you will not be able to do the right thing for your baby. Okay, so you have to be calm. Really, this is a procedure that you're supposed to carry out when you are properly seated and comfortable, so that you can properly balance the weight of the child on your forearm and your hand. Okay, when I mean forearm, this is what we refer to as the hand. This part of the upper limb is what we refer to as the forearm. This is the arm. Okay, so this procedure is something you carry out with the child resting on your forearm and your hand. On your forearm and your hand. Okay, so what are the things you do? Because most times in an emergency situation, you will not have the luxury of sitting down, in order to also calm yourself during the anxiety that is going on and a lot of things running through your head. Most times you'll be on your feet, and that's why we'll be performing this procedure while I'm standing. Okay, because we are trying to make it as practical as possible. Okay, quickly, after you've called for help, please, the first thing you do in emergency situation, after you've assessed that the environment is safe, okay, the next thing you do, you call for help. Always call for help. Or you can ask someone to get you a driver that will take you to the hospital as soon as possible. This procedure with one of your hand, okay, place the palm of your hand on the chest of this baby, okay, and with your fingers you stabilize the head of the baby, okay, the palm. Okay, so this is the palm I'm referring to. These are your fingers. The chest of the baby should be on your palm, and then with your fingers you stabilize the head of the baby. That's what I'm saying. Okay, the chest on my palm. My fingers, I stabilize the head of the baby. Okay, now in stabilizing the head of the baby, you put some of the fingers on the jaw, and while the third finger is on the forehead. Okay, please, you are careful so that you don't use your finger to block the nose, thereby worsening the obstruction to the airway. Okay, and also be careful with your finger so that you don't pierce the eyes of the baby. Okay, so what do? The chest of the baby on your palm, your other fingers, you stabilize the jaw, and then with your middle finger, the forehead. So you have something like this. Okay, so there's room for both the mouth and the nose to be open. And this is the lower limbs of the child. Okay, when we talk about lower limbs, we are referring to both where we refer to as the thigh and the leg and the foot. Okay, so we place them on the sides of our forearm, something like this. So this is this child. This will be placed here like this. Okay, and the second one will be placed. Okay, so you're seeing this. The lower limbs are on the sides of my forearm. This is my forearm. Okay, the lower limbs are on the sides of my forearm. The chest of this baby is resting on my palm. Okay, on my palm. Okay, while my fingers is stabilizing the head. And then you position the child like this. Okay, we want the head of the child should be lower than the body of the child. Okay, and then with your free hand, the heel of the hand here. Don't use the fingers of your hand to tap. No, it's not effective. You use the heel of your hand. You use the heel of your hand to give 5 slaps. 5 slaps. Where? On the back. On the back. Now, why is this important? Because on the back, some people might be giving the 5 slaps on the lower part of the back. No, you are not going to achieve what your aim is. Your aim is to relieve this obstruction, thereby relieving the choking happening in the baby. So what do? You give the 5 slaps on the part of the back that corresponds to the chest of the baby, or that is in line with the shoulder area of the baby. Okay, so the baby is in position. Okay, the lower limb are resting on the both sides of my forearm. The chest is resting on my palm. My fingers are stabilizing the head of the baby. And then I slightly tilt the baby downwards. You give 5 slaps to the back, the upper part of the back. 1, 2, 3, 4, 5. Okay. Now with this free hand, you stabilize the head. Okay, so you hold the back of the head. Okay, and then you turn the baby again with the back this time around of the baby resting slightly on your palm and your forearm. Okay, and then the legs of the baby will naturally fall on both sides. Limbs will naturally fall on the sides of your forearm. Okay, you turn the baby this way. Okay, and you see that this obstruction is still there. What do? You use 2 fingers, and then I intentionally expose the chest of this baby so that you know where we are going to be applying this finger to give 5 thrusts. Okay, so you see this is the nipple. There's the nipple line that runs across like this. Okay, the middle of this imaginary nipple line that run across the chest of the baby, that's where you apply 2 fingers and give 5 thrusts. Okay, so this is what we're saying. This is the baby, 2 fingers. I've already identified with my eyes the nipple line. This is the chest. Okay, so with 2 fingers I give. Okay, slightly again, the position of the baby, the head must be lower compared to the rest of the body. Okay, so with my 2 fingers I give 5 thrusts. With my 2 fingers I give 5 thrusts. 1, 2, 3, 4, 5. Again, I stabilize my fingers, stabilizing the face of the baby, my palm on the chest, and then I turn the baby again. Okay, I continue with my free hand, the heel of my free hand. 1, 2, 3, 4, 5. Turn. Okay, 1, 2, 3, 4, 5. Turn. 1, 2, 3, 4, 5. Okay, you continue this until until one, help arrives. Number two, the choking have been completely relieved. Or number three, when you've gotten to the hospital. One of the best way to dislodge whatever might be causing the obstruction is to carry out this procedure. It will help to dislodge it. Please and please don't wait until an emergency situation occurs before you practice this. You can use a doll like I'm doing, or you can use a teddy bear, you can use a mannequin to start practicing. You don't wait for emergency before you take action on what to do. Okay? Practice before time so that if an emergency should happen, you'll be able to take the right steps in helping to increase the chances of this child survival. Okay? I hope this helps. Cheers.